Okay, my name is Elizabeth Barriteau. I'm the asthma and trachs educator for Cook Children's. And of course today we're going to be talking about asthma and what it is, what it does inside the airways, and what things can trigger it, and what things we can do to help prevent it, okay? Who in here has asthma or knows someone with asthma? Okay, so who has it actually? Okay, all right. I'm sure a lot of us know or heard of someone with asthma because it is so prevalent all over, not just here in Texas, but all over the United States and all over the world. So we're going to talk about the different things, the different components of it, and and all of that, and try to help to be able to understand more about it. They really don't know what causes asthma, but it can be controlled if it needs to be controlled. Some people might have it very mildly and intermittently where they might need medication, they might not. Whereas others might have it very severely and are always having symptoms and need some type of preventive medicine to take care of that. And then there are those that are in between, okay? There is no cure for asthma, but it can be controlled by medications. You might have heard of some people who have kind of grown out of their asthma as they've gotten older. Well, they haven't really grown out of it. Asthma can be known to go dormant or quiet, and may never show up again, or it can. For children, there's a couple things that are happening, and so some of them do seem to get better. First of all, as they are growing older, the airways inside of their lungs are growing larger. And so, say maybe if something might trigger them, they might not close up as much as they normally would have, and so maybe they might not have as bad of a reaction or bad symptoms. Also, children up until about the age of 8 years old, their body is still making new lung tissue. And so it's possible for some of them to make enough new lung tissue to where their asthma is not that much of a problem. But then there are those who, of course, they have trouble, throughout their lifetime. For some, as it goes dormant or quiet, like I said, it may never show up again, or it can. And then it can go dormant or quiet again. It just depends. Everybody is different when it comes to their asthma. They really don't know what causes asthma, but there are factors that can place a person at a higher risk to developing it. Say if that person had been born premature, that is a risk factor. Having seasonal allergies, food allergies, or eczema is a risk factor. Asthma running in a family is a risk factor. There's a virus called RSV that for babies, when they get it, it makes them very, very sick. But for older kids or adults, it's more like a bad cold. But say if that baby had RSV at some point, that's a risk factor. Being of the Black or Hispanic race, it places us at a higher risk than the white race for having asthma too. Okay, so there's other risk factors too, but those are some of the more common ones. I talk to a lot of school-age children, and sometimes when you're talking about lungs and such, they don't have a clue. And I asked one little boy how many lungs he had, and he told me he had 13. I don't know where he put them, but he said he had them, so I said okay. So I bring along my doll Penelope. She's my asthma doll. And I show them what her lungs look like when she's feeling good. We talk about breathing in and out and how the air moves down through all the airways that's inside of the lungs. And when I'm talking to them, I refer to them as air tunnels, okay? Then I show them what it looks like when they're having trouble, how everything has gotten all swelled up. We talk about how hard it is to breathe through a stopped up nose. Well, imagine breathing through stopped up lungs. There's actually 3 main things that happen inside of the airways when someone is having trouble breathing. So here's a nice open airway versus one that's not so open. Around most of our airways, we have these muscles. When something causes them to have trouble breathing, whether it's coughing, wheezing, hard breathing, tightness in their chest, shortness of breath, whatever it is, one of the things that's happening, these muscles are tightening around those airways, making it harder to breathe, okay? Some people take Albuterol, which is, it can be in a nebulizer or an inhaler. What that medicine does is make these muscles relax so those airways can open back up. Now that type medicine works quickly, but it doesn't last very long. It's mainly to be used on an as-needed basis. For some people who might have symptoms every now and then, they use that medicine every now and then, no big deal. But then there's that occasion where something might have triggered them hard enough, or their asthma's at a level to where they keep having reoccurring symptoms, and what's happening, the airways are swelling and extra mucus is being produced. When that occurs, those breathing treatments can't touch this. And so it might seem like the breathing treatments are not working. They really are working here on the muscles, but this is the bigger problem. And this is what we gotta get under control and keep under control. So a lot of times when our children come into the hospital, they come in through the emergency room, they're given lots and lots of breathing treatments. And the reason for the breathing treatments is try to keep those airways open as long as they can until they also are given some steroids, whether it's by mouth or by IV. What the steroids do is take away the swelling, help control that extra mucus, and also calm those airways down. But steroids take a while to start working. That's why all those breathing treatments until the steroids kicked in, and then they're able to back off on some of those breathing treatments. To give you a better view of this, take a look at how nice and open this section is versus here. Okay. And so all that hard breathing, the coughing, the wheezing, and all of that is because they're trying to breathe through those tiny, tiny air spaces. Okay. One of the biggest problems with people who have asthma is their airways tend to keep wanting to swell. And even when they're not having any symptoms, there is still a little swelling in those airways. It's not bothering them, it's just laying there and waiting until something triggers it, and then here comes that swelling. Another way of looking at this is this nice open airway. The wall around the airway is nice and thin. The muscle around the airway is nice and loose. Now when someone starts having trouble breathing, the wall of the airway gets thicker, the muscles around the airway start to tighten, and mucus starts being produced. If it's allowed to continue, the wall of the airway gets even thicker, the muscle around the airway gets even tighter, and more mucus is produced. So which means the diameter of the airway gets a lot smaller. And then of course if it continues, it can get to the point where that airway is closed down all the way. So we've talked about the tightening of the muscle around the airway, which the albuterol takes care of. And albuterol has many different names. It can be albuterol, meaning the generic name. It can be Preventive, which is this inhaler here. It can be Xopenex, which is a form of albuterol. It can be Proair, which is albuterol. And there's some others too. Different companies make albuterol, so they want to name it different things and they want it to look differently. It's kind of like a car is a car. They get you where you need to go, but different companies make them, so they want them to look different. And it's kind of confusing sometimes for our families when they'll say, well, and a lot of times when I ask them, well, what's the medicine they use? They don't remember. I said, well, what color is the inhaler? And that's when they tell me, you know, he's got a blue inhaler, he's got a red one. Well, now when it comes to red, there might be two different kinds of inhalers, one that is a preventive, one that is a reliever as the albuterol, but we'll get into that in a minute. As far as things that can trigger someone's asthma, there's so much in our environment that can be a trigger. Some things we might be able to figure out and avoid, some things we can't. I've given each of you a trigger chart, and I have the families look at these, not to say that these are all the triggers that their child has, and there's still so many more out there. But I give this to them just so that they can kind of get their mind going as far as what could possibly be a trigger. Okay. Now say something might be triggering you and you just can't pinpoint what in the world it is. By keeping a diary or a journal or even on a regular wall calendar, if the person is having symptoms, write those symptoms down on that date. Kind of pay attention to where you were, what you might have been doing. If you've got to take extra breathing treatments because of those symptoms, write that down too. Because over time, you might start seeing a pattern and figure out something else that can be a trigger. And keep that chart or that calendar ongoing, because as seasons change, so do triggers and temperatures and all that kind of stuff change too. And then if you remember the next time you go to the doctor, take that with you so that the doctor can see what pattern that you're in, because you might notice that in this season you have lots and lots of trouble with your asthma, but in say another season you're doing pretty well. So maybe in that bad season you might need more of a preventive type medicine to control your asthma versus the other seasons. Now unfortunately, there are some who have trouble all year round, but it will help in fine-tuning, what type medication that might be needed. Like I said, sometimes we might not even think about it. And I also talk to school nurses a lot of times, and I tell them, and teachers, and I tell them, do not be a trigger. Meaning, don't come into that school with all that perfume or cologne on or smelly stuff, or in your classroom have the air fresheners and all those strong smelling things, because there are so many people with asthma, not just children, even adults, and we need to be mindful of them. Okay, a big trigger for children with asthma is the common cold. They catch a cold, and maybe for days or a day or two, that's pretty much what it is, the symptoms of a cold. And then that cold triggers their asthma, okay? Allergies, seasonal allergies, happen in what we call our upper airway, whereas asthma happens in our lower airway. If our upper airway gets out of control, then it can trigger the lower airway. So we try to keep both of those airways under control, okay? Cold air. In the wintertime, we see this a lot, where they breathe in that sudden cold air, and it doesn't really get warmed and prepared by the time it hits the airways, and sometimes that triggers their asthma. Okay. Another big one is tobacco smoke. And when I'm talking to my families, if I ask, does anyone smoke, and they might say yeah, or they might say, well, I do it in my house when they're not there, or I do it in the car when they're not there. That does not matter, because that secondhand smoke smell is embedded in the carpet, in the fabric, in the draperies, in the car. It's there. And so anytime any of us smell that secondhand smoke, it is just as dangerous to us as if we were to take cigarettes and smoke them ourselves. So we ask that you don't smoke in your house or in the car. And if you still need to smoke, when you go outside to smoke, put on an old shirt or jacket or something while you're smoking, and before you come back in the house, leave that piece of clothing out there so they can air out, and also wash your hands, okay? Also too, as far as some of them might say, well, I only smoke in my room, but the air travels, okay? So the key is not smoking around the children at all, at any time. Now, as far as the medications, there's a lot of them out there. I mean, there's two main medications, but like I said, there's different brands and such out there. The Albuterol, whether it's in a nebulizer or it's in an inhaler, it's the same medication, just delivered in different ways. Some people prefer the nebulizer over the inhaler, or vice versa. It doesn't matter. Some people think that the nebulizer medicine gives them more because they see all that liquid inside the nebulizer cup. Most of that liquid is normal saline. Years ago, we did not have the pre-measured vials, and some of you might remember. We had a small brown dropper bottle of medicine and a large canister of normal saline. You squirted a couple drops of that medicine into that nebulizer cup, and then you squirted a whole bunch of normal saline. Because if you had just put the medicine in there and turned it on, it would be gone. So the normal saline just helped to nebulize it longer. It might give you more moisture, but the inhaler is the same thing minus all that normal saline. Okay. A lot of our hospitals are going more towards the inhalers versus the nebulizers. Nebulizers will still be there, but some are going more towards that. And we see also a lot of times our parents prefer the inhaler because it is quicker, and you can carry it with you wherever you need to go. So when it comes to the inhaler portion, of course, all inhalers, before you use them, especially when they're brand new, you need to do what they call priming it. And what I mean by that, you take the cap off, you shake it up, spray it into the air 4 times. It's called priming. What it has done is, the medicine and gas that's in this dosing chamber, even though you shook the canister up, it did not shake up. It did not mix together. So we just want to get that portion out because it's not really of any use. With any inhaler, when it sits for a bit, the medicine and the gas separate, okay? If we were just to pick it up and take it, most of what we're going to get is the gas. So when it is brand new, that medicine and gas in that dosing chamber has also separated. Even though we might shake it up, we're going to mix the medicine and gas that's in this canister, but that's in that dosing chamber is not going to mix together. So we just want to get rid of it. So we prime it 4 times to get rid of that, okay? Then you can use your inhaler. Now, if it's a reliever inhaler or rescue, or some people call it a quick relief, if they have not used it in over a week, they need to prime it again, but just a couple puffs, okay? There's a chart that shows all the different medicines and how to prime all of them, and all of them are different. And so we just kind of average it out to if they haven't used it in a week. With any inhaler, it's best to use what we call a spacer or a holding chamber. Whether you are a baby on up to an elderly person, spacers are good for anyone, any age. The reason why, and I'll show you with this one, that medicine sprays out pretty fast, about 50 to 60 miles an hour, they say. Even us as adults, trying to squirt and breathe in and get the majority of the medicine into the lungs where it needs to be, doesn't happen all the time. Do you sometimes taste your medicine? Yeah. Mm-hmm. The reason why, because of how fast it sprays out, it sticks in the mouth and in the throat. You only get so much in your lungs. And then when you swallow, that's just stuck in your mouth, that tastes nasty, goes in your stomach. Doesn't do you any good, okay? Spacers or holding chambers are your best friend. You can either shake the inhaler first or put it on your spacer and shake it. It doesn't matter, as long as you shake it up, okay? You're always only going to spray 1 puff of medicine in here at a time, even if you're going to do more than 1, just 1 at a time. There's a valve here that's going to keep the medicine in when you spray it. So you spray the medicine in, and that because it doesn't come out, it slows that medicine down. You put your mouth on the mouthpiece, you take a nice slow deep breath in through your mouth, hold your breath for 5 to 10 seconds, and then you're going to breathe out. Because the medicine slowed down, now it's going more with the same speed of the breath, so the majority of it gets into the lungs, less of it in the mouth or throat. Okay. For a younger child who does not know how to breathe in and hold their breath, we put a mask on it. This just goes over their nose and mouth, and they just breathe in and out about 6 or 7 breaths. When they breathe in, this valve opens. When they breathe out, this valve actually closes, and they actually breathe out here. And I'll show you. If you are using the mouthpiece and you breathe in too fast, you're going to hear this. If you make that noise, it means to slow that breath down. Because sometimes if we breathe in too fast, some of our airways have a tendency to open and close right back up. Whereas we want them to open and stay open to give that medicine time to get down into our lungs. And then of course, when we hold our breath, that medicine, the lungs are staying open so it can get down even further. So spacers are good for anyone, any age. But say maybe you don't have a traditional spacer. Some of the nebulizer kits will come with these blue or white pieces of tubing. This can be a spacer. You just improvise. Just goes on right there. It gives you space. It slows that medicine down before it reaches the mouth. Now, of course, you'd have to have your mouth already on there because there's no valve that's keeping it in. And you can't breathe back and forth through it, but it does slow that medicine down. We've even had where we've seen someone who didn't have anything like that, but they had a water bottle, a plastic, simple drinking water bottle. They cut a hole in the bottom of that bottle to stick their inhaler in, and then, of course, the mouthpiece of the bottle was the mouthpiece for them to use. And so it slowed that medicine down before it got to the mouth. Now, as far as the different types of medicines for asthma, of course, there's the quick relief or rescue or reliever medicine, meaning the Albuterol. And remember, That medicine relaxes these muscles that are squeezed around the airways. It's quick acting, but not long lasting. You use it on an as-needed basis if you're having symptoms, okay? One other reason why someone might use that medicine is for pre-treating before activities. Because as you might have noticed on your trigger chart, activity or exercise for some people can be a trigger. But that's one trigger we do not want them to avoid. What is happening is, right now, all of us are breathing in and out through our nose. Our nose hairs are filtering out some of the stuff in the air. As that air is traveling down into our lungs, it is picking up the warmth and moisture from inside of our body. So once that air reaches our lungs, it's filtered, warmed, and moistened. Our lungs like that. When you're running and doing, you're breathing a lot faster through the nose and the mouth. The air is not totally filtered and is traveling quicker, so it still can be kind of cool and dry, hits those airways, and for some people, their airways don't like it, and it triggers them. So what they can do before that activity is what they call pre-treating. Take a couple puffs of their albuterol inhaler or nebulizer treatment, anywhere between 5, 10, 15 minutes beforehand, and that will help them not to be triggered. There's even some well-known athletes with bad asthma, and you wouldn't know it. Emmitt Smith of the Cowboys is one of them. That crazy nut Dennis Rodman who plays basketball is another. Jackie Joyner Kersee was a sprinter in the Olympics years ago, won 8 gold medals, bad asthmatic. Kenny G, the jazz man. David Beckham, the soccer player. Justin Bieber, that singer boy, also, okay? So it does not have to stop them, and it should not. Asthma should not control someone's life. They should be able to control their asthma. Now, in talking about that, sometimes our families don't know whether that asthma is under control or not. And so there's these 3 questions that I'm going to read to you. It's called the rules of 2. And if you answer yes to any of these 3 questions, it means that asthma is not fully under control. It goes like this. Do you have to use your quick relief medicine more than 2 times per week? Do you awaken at night due to asthma symptoms more than 2 times per month? Do you have to refill your quick relief medicine more than 2 times per year? And if you answer yes to those questions, that means that asthma is not fully under control. And some people are quite surprised when they realize, I'm not under control. I thought I was. Or it might have been that it's just the way it is. They're used to that. And we don't want you to get used to that. We want it to the point where you almost forget you have asthma. And I tell my young patients that I know you don't want to have asthma. Nobody does, but you do. But you can control it. Because even though you have asthma, you should be able to live as normal life as anyone else, participate in any activity or sport you want to, have as many symptom-free days and nights as possible, and also only have to use your albuterol, whether it's in the nebulizer or the inhaler, on a very infrequent basis or hardly at all. The amount of times that you miss school goes down. The amount of times that your parents are missing work goes down. The amount of times that you're waking up at night goes down because your asthma is being controlled. In talking about the controllers, there are different medicines, different brands, I should say, of the controller medicine. And it might be, you might hear it referred to as a controller or a preventive medicine. And what they are the inhaled steroids. And for some people whose asthma is at a higher level to where they keep having those reoccurring symptoms, remember the big problem is that swelling and mucus that keeps reoccurring. And that's what we've got to get under control. Because if someone's asthma is allowed to stay out of control, say over their life, there eventually is going to be some permanent damage that's going to occur. And when I mean permanent, it's permanent. We can't do anything about it. As those airways are allowed to continue to swell off and on, the wall of the airway starts to scar itself. And as it does, the wall of the airway gets thicker and thicker, which means the diameter of that airway gets smaller and smaller. You might hear it referred to as the airways are becoming remodeled, okay? That scarring is a permanent thing. And unfortunately, some people that you might see out in the community that are having to wear oxygen all the time, some of them have other health issues, but it's possible that others, their asthma has been out of control most of their life and now they are permanently short of breath. And we can't do anything about that. But we can prevent it on the front end, okay? So, there's a couple different preventive meds that are there to take care of that asthma. Now let me step back a minute. We talked about the oral steroid or the IV steroid that a lot of times that are given when someone's having such a bad time with their asthma. Both those type steroids are very good. They control the swelling and the mucus and they calm those airways down, but they're very strong. And they have to travel through the body to finally get to the lungs to do the job they need to do. The longer you're on those type steroids, the stronger the side effects. So we normally only use those steroids in, say, a 5 to 7 day period of time. Now, say for someone who, once that steroid leaves their body, here comes that swelling and mucus back, that's when we look at the inhaled steroids, those that you breathe directly into your lungs. They're a lot safer to take for longer periods of time because they go directly to the lungs, they don't have to travel through the body, and we can use it at a lot smaller dose. The key is, though, those inhaled steroids are considered a preventive medicine. And with any preventive medicine, the only way it's going to continue to work is if you continue to take it. Yes, those symptoms are going to go away, but most of us are guilty at some point in time where we'll take medicine till we feel good and we stop. Now that's okay with albuterol or say headache medicine, that's okay with. But how silly does this sound? I took my birth control this week and I didn't get pregnant, so I won't take it next week. Preventive, yes. One day I said that to some parents and they're like, the dads are like, oh, yeah, preventive. So there's a couple different inhaled steroids out there, and you've probably seen a commercial for one of them, Advair, which also comes in an inhaler form. There's Dulera, there's Symbicort, there's Qvar, there's Flovent. Asthma comes in 2 different strengths. There's also Pulmicort, which comes in a liquid form that you put inside the nebulizer cup, and they breathe it that way. Most of the time, you see that with the smaller children, okay? Whichever the inhaled steroid, it doesn't matter. It needs to be taken daily. Usually it's in the morning and at night, okay? Like I said, those symptoms are going to go away, but they need to stay on it. It might just be through their certain season. Say maybe it's fall and winter is their worst season. But then once spring comes and settles down, they can come off of, until right before the fall starts again. Others, it might be all year round. It just depends on that person. Now, a very important thing with any of the inhaled steroids, after they take that steroid, they need to either rinse their mouth with some water and spit it out or brush their teeth. The reason why, because if you're inhaling it through your mouth. And with it being a steroid, a little bit of that steroid can linger in the mouth, even though you're using a spacer. That steroid lingering in the mouth for some people can cause like a thrush or yeast type rash in the mouth. So to tell everyone who does any kind of an inhaled steroid afterwards, rinse or brush, okay? And always, always, always use your spacer with, of course you want to use it with all your inhalers, but especially for the inhaled steroid. We want as much of that medication getting into the lungs where it needs to be so that it can control that swelling and mucus that goes on. With those different steroids, depending on the level of your asthma, will depend on which ones that the doctor might prescribe. For someone who has, say, mild to medium persistent asthma, the doctor might prescribe just a simple steroid, which would be the Qvar, the Flovent, or the Pulmicort that I was telling you about, or even the Asthma-Nex. They're just simple steroids, that's it. And for those people with that degree of asthma, a lot of times the simple steroid will hold them. But then there are those who go from moderate to severe, who even though they're trying just that simple steroid, they keep still having reoccurring symptoms. Well, just that simple steroid is not enough for them. So then they will switch them to what they call a combination drug, which is the Advair, the Dulera, and the Symbicort. Yes, they are a steroid, but in there with that steroid is also a medication like the Albuterol, but it's longer lasting, okay? And so when they combine those two, the inhaled steroid and the longer lasting Albuterol, it holds them better. And so they consider these combination drugs. You take it the same way as the other inhaled steroids. Most of the inhalers will have a counter on them so that it counts down by 1 so you know how many more puffs of medicine you have. The Advair And the the Flovent and the Dulera have them on the back of the inhaler. Symbicort has it on the top. It's a dial that counts down by 1. The Advair disc has a little window here that shows the numbers that count down by 1. Also, the Advair disc is actually a powdered medicine. There's capsules of powdered medicine in here. And when you breathe it in, of course, you inhale it into your lungs. The Asthmadex is also a powdered inhaler, okay? It also has capsules in there that once you open it, it opens the capsules up, and then you inhale those also. One other medicine or inhaler that does have a counter is the Proair, which is an Albuterol, but mine is an older model. The newer ones also have a counter back here. Eventually, we've been told that all of the inhalers will have counters. It really makes sense, the reason why. Remember, they're aerosols, right? Have any of you used spray paint before? Okay, you shake it up, you're spraying with it, you know, and eventually the paint starts to spurt. And then eventually the paint is gone, right? But you still have a lot of gas. Well, it's because there's always going to be more of the propellant gas than there is of whatever the ingredient is in there. Same thing with inhalers. There's more propellant gas in here than it is medicine. But if you don't know that, because there's nothing to indicate that, you know, all of my medicine is gone, you're going to keep using it until it's totally gone. Well, they can have up to about 20 puffs of mostly just propellant gas. So here you are, you know, using it until it's finally gone. Well, eventually you're going to start noticing too it's not working, because most of what it is the gas. So it will be so much better for all of us if those inhalers have counters on them. Now you might have, especially if you are familiar with inhalers from a long time ago, and some of one of the things that they said, in order for you to know how much medicine is in there, you take it apart and you stick it in some water. Anybody ever heard that? Well, don't do this, but you would stick it in the water, and depending on how it floated, would tell you how much was in here. Well, it don't tell you whether it's gas or medicine, right? So if you hear that, just tune it out. Don't take it apart and stick it in water. It's not going to do anything. Okay, all right. One of the things that you get before you leave the hospital is one of these. It's called a home management plan of care, or you might even hear it referred to as an asthma action plan. It will already be filled out, and they'll go over it with you before you go home. Up here are just a few of triggers, just as a reminder. The green zone, meaning go. You're doing well. You're not having any symptoms. But if you are on a preventive medicine, whether it's an inhaled steroid or whether it's allergy medicine, because remember, we've got to keep those allergies under control too, and so that's considered a preventive, the allergy medicine, that medication will be listed here. It will tell you how often to take it and how much, okay? You take it daily. Even once those symptoms go away, stay on it for however long your doctor wants you to be on it. There's also a little reminder about rinsing your mouth afterwards. The yellow zone, meaning caution. You're starting to have trouble. Coughing, wheezing, hard breathing, tightness, shortness of breath, whatever those symptoms are. Then you would use your quick relief medicine, your Albuterol. Whether it's in a nebulizer or the inhaler, it doesn't matter. So it will tell you how often and how much of that to take. And you can take extra doses of your Albuterol, but never extra doses of your preventive medicine, okay? If those symptoms stop, then you can stop that Albuterol. But remember, another reason why you might take your Albuterol is for pre-treating before activities, if you find that activities are a trigger for you. The red zone is here because, say, maybe everything that you're doing is not working. Then you will have instructions in that red zone too on what to do if you should get to that point. Okay. If anyone takes care of your child outside of the home, make a copy for them too, including the school. One other thing that I've given you, for those who might have a smoking issue or someone who does smoke, I've given you a copy of this diagram just to show that Smoking just doesn't affect the lungs. It affects a lot of part of the body, and this is even all the parts of the body that it does affect, but just as a reminder. Also, Tarrant County has a free program for those who might decide they want to stop smoking. They have a free program, and that's what this form is about.